Today I'm going to take you through a beautiful foam roller exercise which works on not only the muscles but also the fascia. The fascia is an interconnected web that holds together all of the muscles and ligaments, and it is an extremely important part of the outcome of your birth. Fascia is best supported when you're hydrated, drinking lots of water. If you are dried out and you're not drinking enough water, the fascia is not going to have enough movement and you're going to be extremely tight and unbalanced, which makes it for a much longer and harder labor. So by working on your fascia, drinking lots of water and massaging it out, you're going to increase your chances of having an easier birth. So get your foam roller. We're working on the lower body today. This can be done in the 2nd or 3rd trimester, and it's extremely important to listen to your body. So let's sit on the foam roller here and place our hands behind our back, and we're just going to roll out the lower back and the glutes. If at any time you feel dizzy or anything that feels uncomfortable, please immediately stop. Beautiful, getting that lower back out. Now we're going to rotate to the side, placing that right leg behind you, and we're working on the hips and the IT band. So our left arm is supporting, our right leg is supporting, and we're just going to roll out those hips and the glutes. So you work your fascia with a combination of compression and movement. Now, if somewhere feels more tender, please just linger there. Being sure not to go too high up, not to touch your belly at all. Just working on that glute muscle at the moment. Okay, beautiful. Let's lift up to a side plank and move the roller a little bit further down. And now we're going to roll out that IT band. This can be extremely painful for some people, and that's a big indicator that you need it. Rolling it out, beautiful. And now we're going to rotate to work on the quad. Place that right leg on the floor. Both elbows on the ground. Now we're parallel towards the floor. Now we're working on our quads. Might want to move the roller lower. Now this is a really intuitive practice. It's really important to feel your own body and feel where's more tender. All of these aches and pains are an indication of what you need to work on. And by rolling out and giving yourself this self-massage, there's so many positive benefits. If you're in your 3rd trimester and your belly's quite large, you might be up here with straight arms. And that's okay, that's still really safe for your baby. Beautiful. Come up on all fours. Now we're going to do the opposite side. So let's start with that hip. Place the right arm on the floor, left foot is supporting you. And we're going to just roll out that glute and that hip muscle. Being really careful not to touch the belly. This is a fantastic practice to do as often as possible. It's extremely powerful in the outcome of your birth. Let's bring the foam roller a little bit further down now. Working more in the IT band. And again, listening to your body here. Where is most painful? Where needs a little bit more love and tender love and care? Lightly moving it down even further. Oh, this side's a lot tighter for me. Beautiful. Now let's rotate. We're facing towards the ground now. Both of our elbows stabilizing ourselves, and that left leg is stabilizing us. Let's work the quad. And coming all the way up to the hip bone. Moving all the way down to the knee. And you can do this for as little or as long as you like. This is so incredible to get blood flow and oxygenation into this area of the body, which can be extremely powerful, especially if you have swelling. Of course, if it's an uncomfortable pain, if there's any shooting or sharp pains, please immediately stop. But having that blood flow and that oxygen through the body is just so beneficial to you and your baby. Beautiful. And now let's come back up. We're going to work on the inner thighs. The inner thighs are really impactful for our pelvic floor. So let's place our elbows on the ground. We're going to roll out those inner thighs. And again, stopping on one spot if you notice it's tender. And understanding that by stopping, you're working the muscle deeper, and by moving and compressing, you're working the fascia. Both are important. And let's come onto the other side. Move that foam roller onto the other side. Elbows come back down, or maybe you have straight arms if you're in your third trimester. Or even if you're in your second trimester, whatever's comfortable to you. There's honestly no rhyme or reason with this one. It's really flexible for you to do what feels best for you, and I encourage you to do what feels best for you. As long as we're not rolling out our belly, then it's very safe. I wouldn't encourage anybody to do this in their first trimester, but second and third, very powerful. Amazing. Can remove the foam roller. And there you have it. Thank yourself for carving out this time for you today. And I hope you have an amazing day.